Welcome to the ISOHA Oceania Who's Who in One Health Regional webinar. So this webinar is essentially going to be serving to both provide information to you, the viewers, as well as help us to build our regional communities. In this case, Oceania. This was formerly the ISOHA Australia group, but that is kind of a bit segregating in the modern day and age, and frankly, we need to be more inclusive of the other Pacific islands in the region. So, without any further ado, welcome to the ISOHA Oceania Who's Who. Just some brief little introductions about who's going to be speaking to you today. I am Patrick on the right there. I'm the ISOHA's Executive Committee Vice President for Finance. We're also joined by Andreas, our president, and Bailey, the VP for Education. You guys can introduce yourself. Jump on, Andreas.
Sorry for the delay. Hi, guys. I'm Andreas Papas, the Vice President of Education of the previous year and the current President of the upcoming year. I'm a vet student from Greece, and I'm very happy for this meeting. So maybe there are not many people in this meeting, but this is a nice place to create new things and brainstorm how we can bring more people from your continent in ISOHA and in our meetings. So have a nice meeting.
Yes, I should also note it'll be recorded and put on YouTube for those who aren't able to make it today. Bailey, if you want to jump on and give us a brief intro.
Hey guys, I'm Bailey Archie, and I'm the incoming VP of Education. And this past year, I was the event manager for the Educational Committee, running a lot of the webinar type things. And I'm a third-year veterinary student at Mississippi State, which is in the US. So looking forward to it.
Grand. Alrighty. We'd also hoped that Will and Grace were going to be able to join us. They're our continental representatives for Australia, the people who are sort of the middle people between the executive committee and the wider regional community. So hopefully we can start getting some commute between our participants out throughout Oceania, between them and the continental reps, as well as between the continental reps and us. Alrighty, so that's pretty much who we are and what we kind of stand for. But here's the schedule for the rest of the meeting. So we're going to essentially tell you what ISOHA is, for those who are unaware. We're going to give a bit of time to introduce student groups, seeing as there's not really too many of us on the webinar and we didn't have too much uptake on the student group front. We'll just give it time to sort of to branch out and meet each other and see where we're all at in our different journeys in One Health. Then we're going to have a little time to talk about what student life has been like during the pandemic. It's one of those unavoidable things in the current day and age. Then, depending on how long that takes, we'll have a little break, get a coffee, that sort of thing. Then we'll talk about the partnerships that ISOHA has currently and the ones that we hope to have in future. And we'll move on to, well, the future of ISOHA and how we want to branch out and keep on being sort of a blossoming community for people and students, particularly in One Health. And then we'll wrap it up with the little acknowledgements and close the ceremony from there. Alrighty, but first and foremost, what is ISOHA? So ISOHA stands for the International Student One Health Alliance. You can see why we abbreviate it. And we essentially serve as, for three main purposes. We are here to connect students, principally, across the world in their different pursuits of One Health strategies and solutions, principally done through different One Health student groups. That's how we try to reach out to individuals and try to connect to them within both regions and internationally. We are here to provide a platform for the students to share their different opportunities, collaborations, and what they want to be doing in future, or research that they might want to be conducting, or might want advice for making it in a more sort of One Health fashion. And we're also here to raise awareness for One Health approaches and the interdisciplinary thinking that underlies the One Health concept itself. I don't know if you had any further points on that, Andreas? All good. We'll move along. So here we just have some pictures from various different efforts in the US, in the Asia Pacific region, as well as in South America and the African region as well. So a lot of our groups have been particularly industrious, but we have room in the platform for anyone who's just if it's sending emails versus being launching big interdisciplinary projects. There's really room for everyone under the ISOHA umbrella at this point. So the executive committee essentially assigns each of the continents, as we loosely call them. They're more like regions, but for all intents and purposes, we have continental representatives. So in Africa, we have Yusuf and Elekana from Nigeria and Uganda, respectively. In Asia, we have Anila and Krishna, who I believe Krishna is actually on the call right now. If you want to unmute and say some words, we'd be happy to hear them. Oops, sorry, I've just unmuted you. But
Hello?
If you've got nothing to say, no problem.
Is it audible? Is it audible?
Yes, we can hear you.
Okay, hello everyone. This is Dr. Krishna Adhikari. I'm from Nepal and I represent ISOHA for the Asia continent. And I've been serving the ISOHA since 2019. And we have recently conducted the ISOHA regional webinar on June 20. And we had the Asia regional ISOHA, and we help in the student One Health groups for conducting programs for community mobilization, for organization of groups, and linking to the ISOHA Executive Committee and the One Health Commission. Thank you.
Thanks for that, Krishna. I should say that the ties between Australia and Asia in terms of continents is very close, obviously, and obviously these sorts of things are it's sometimes difficult when we divide the continent geopolitically versus continentally. So there's obviously some very close ties between Oceania and Asia. So it's good to have strong collaboration there. Again, as I've said before, Will and Grace are the Australian or Oceanian representatives. We also have Elspeth and Ergie in Europe, Jessica and Evan in North America, and Luigi and Daniel in South America. And so these form our sort of committees from here, though in the coming year we will actually be going through a bit of a re-roll of these different representatives, and we'll essentially be seeing, it might be still again 2 continental representatives, maybe more, could be less, or subcommittees and such from that. So we're still the executive committee itself has just undergone a reshuffle. So we'll see really what is the best in terms of operation for these things. But it could be an opportunity for people to step up and join us in organizing through ISOHA. So our One Health student groups across the globe, you can see them scattered here. This is one of the most up-to-date maps, and you can see it down at the URL in the bottom left. You can see there's quite a lot in the Americas, in Europe, and through sort of the middle of Africa there, as well as quite a few in Southeast Asia. And we divide them as sort of such into the basic North America, South America clusters, as well as the Europe, Africa, and Asian clusters. These are just for brevity, not necessarily reflecting the continental divides. And here is the Oceanian cluster, as much as we can fit in there for the time being. Going forward, we also try to gather all the One Health opportunities. So opportunities for education, whether that is undergraduate through to postdoctorally, and other projects that might be offering some paid or volunteer opportunities within the One Health sphere. And we try to highlight them on a map as well, to not only give you the opportunity to view where you can go with One Health opportunities, but how you can get there, and in some cases quite how easily. Again, the URL just down in the bottom right. I don't know if Andreas, if you wanted to chime in on anything about these opportunities or the student groups. Well, we'll keep going.
Not actually, I don't have something. Thank you.
Alrighty, so here we've sort of spent time to talk about the different student groups and give them time to introduce themselves. So I guess we'll just we can go through and unmute you, and we'll just have a chat about, I guess, your path, not necessarily as part of a student group, but your journey in One Health, or what is bringing you to One Health Day, or bring you to ISOHA, for that matter. So we've got Andreas, with Krishna, we've already heard from you, and we've got Navneta. I'm sorry, I'm probably not pronouncing that right. Can you hear us, Navneta?
Yes, I can hear you.
Okay, excellent. Why don't you tell us about a little bit about yourself and what brings you here today?
Okay, so hello everyone. I'm from Fiji. My name is Navneeta. I have graduated last year with a Bachelor of Medical Laboratory Science, and I actually got an email from you, so it's a privilege to be a part of your webinar today, and it's great to hear from you all. I'm actually the president of the Pacific Medical Students Association. I've been appointed the president this year, and I would like to know more about your association, about your organization, and how do you do your networking, and where your representatives are. And it's going to be a good session, I believe. Thank you.
Excellent to hear from you. Yes, no, sorry about the outreach for this has been a little bit lackluster. That's mostly been left to me. So I had to sort of spam out a lot of email. But I'm very happy that you've joined us, because we haven't had as much engagement with the outer oceanic region. So it's really good to hear you and see that you've been so active as well.
Thank you.
And that essentially is us, unfortunately. But I guess we can sort of talk a little bit about what also brings us here. So I guess I should have done this a bit before, but talking about my journey in One Health, I'm a biotechnologist by training, and effectively I started doing what drew me to One Health was a fascination with the veterinary medicine and comparative medicine, but more from a molecular angle than from a hands-on dealing with animals level. And I've worked with the Tasmanian Devil facial tumor disease group, and that kind of drew me into the world of comparative immunology. And from there, I've gone on to do a master's in Europe in One Health and infectious diseases, and I'll be pursuing a PhD at some point in the future, also in integrated One Health solutions through the University of Edinburgh and Leiden. And that's kind of been my journey so far. And ISOHA has kind of been in there since the start, branching off from my relationship with the One Health Commission. And I was simply given the opportunity to apply. I applied, and I got in originally as the secretary, and then transitioned from there to the VP of Finance that I am now. I don't know if Andreas, maybe you wanted to jump on and share your sort of journey through One Health and also ISOHA.
Yes, actually, mine is not any impressive than yours. I'm just a veterinary student in Greece. So here we have a group which is a veterinary students group, not in One Health. But we had the place for a person like a One Health officer, we can call it in English. And then I get inspired to race for this place, to run for this place. So I did it, and then I realized that there is so many things that I can do working on One Health topic. So I still being a student, then I expand my One Health um, way of thinking, I could say. And then I found ISOHA 3 years ago. So I was following, and then the same as Patrick, when I found the applications, I just said, now it's my chance to do something in a more broader level than local here. But I'm still working local and very excited to spread the One Health idea.
Grand. Krishna, I'm not sure. We know you're a Asia representative, but I'm not if you want to tell us a bit more about your journey in One Health and how you linked up with ISOHA. I'll just unmute you now.
So hello, this is Krishna again, and I'm ISOHA representative for Asia. My journey began when I started my veterinary medicine during the year 2013, when I joined the undergraduate course for veterinary medicine in Nepal here. In beginning our journey, we have a small informal organization that was formed by our seniors that used to conduct the mass awareness program regarding zoonosis, the disease such as rabies, and they used to conduct vaccination campaign, rallies, and so on. And then after 1 or 2 years, it began group called and since then on we have been working on the field of One Health. We are basically organizing various programs. We are incorporating the personnel from the medical field, from the public health, and every domain that we can, from the environmental science, and every domain that we can to the common umbrella of One Health Nepal. And we have been organizing various programs that can reach to the grassroots level in the community, to the people who essentially need the One Health. Recently, which has been more realized that it is needed to be the most important concept in the grassroots level. So we have been conducting various programs since then, and it was during 2018 when I was about to graduate from my veterinary college. I formally applied for the position of ISOHA, but previously many 3 or 4 more years ago, we have been affiliated with the One Health Commission, and we have been organizing various programs. We have been listing programs on the web's portal of One Health Commission, and organizing various campaigns, and thus I began heading the Asia region for ISOHA, and now it has been one of the part of my life, the One Health, and I'm working towards it. Thank you.
Excellent, thank you. And maybe Bailey, if you wanted to sort of expand on your background as well, if you're free to do so.
Sure. So when I was about to start vet school a few years ago, it was the summertime, and I was just watching TED Talks for fun, and I came across a TED Talk by Dr. Barbara Patterson Horowitz, who is a physician who wrote a book called Zoobiquity, and it was basically just about the connections between animal and human health. And I really enjoyed her TED Talk, and then I read her book and really enjoyed it, and was really just drawn towards the fact that veterinarians could improve human health as well. And I think that was also something that appealed to me because I don't know if maybe any of the other vet students here have experienced this, but I felt like my family and friends that knew I was about to start vet school didn't realize, you know, that vet school in the US is 4 years, just like medical school, and people may not, you know, think that vet school is as challenging as medical school, or they just don't realize the value that veterinarians have in improving health for, you know, all species and not just animals. And so I was like, oh, this is great. Just thinking about how, you know, my profession does have value in improving health for humans as well. And so that's how I initially got started in One Health, or interested in One Health. And then my interest just kind of grew from there. And I actually met Neil Vizzo, one of the past presidents of ISOHA, at a conference and told him I was interested in One Health. And he said that applications for the educational committee would be coming out shortly. And so actually on my way home from that conference, the applications for the educational committee were released, and I applied and was chosen to be the event manager. So yeah, that's a little bit of my journey so far, and I'm interested in large animal medicine, so I'm hoping that you know, I can maybe get the agriculture involvement in One Health a little bit, because it seems like the agriculture and One Health interests don't overlap often. So I'm hoping I can maybe kind of be that bridge, and I'd like to do agriculture policy type stuff in the future. So that's me.
Excellent. Thanks for sharing. Alrighty, so that's sort of given us all sort of an idea of everyone's background within the group. And now we can, I guess, address the elephant in the room, so to speak, that is student life in the pandemic, and sort of more contemporarily what we've all been doing, particularly in the past few months, and how we've been impacted by the pandemic. So I just set out a few simple things. We've kind of already discussed our stories before the pandemic, but I guess immediately before is what I want to issue there. And then the changes that we've had to make because of the pandemic, and ultimately to sort of end on a softer note, a positive outcome from the experience, whether it's been whether you've been doing a little bit more yoga, or whether you've been learning how to make your own sourdough, those sorts of little things that are the lights at the end of the tunnel. So I'll kick it off. So unfortunately, COVID hit pretty hard where I was studying, the UK. And still unfortunately going through its own bit of ripeness, and from there I essentially had to make a decision as soon as the research labs closed where I was conducting my research, as to whether I would stay in the UK or return to Australia. And I ultimately bit the bullet and came back, which turned out to be an excellent decision, because the UK's numbers kept climbing and Australia kind of just sat where it was. The privilege of having such a large land mass and a small population, I think. And I've been able to just sort of stay down here in my home in Tasmania, away from most of the rest of the world. So it's been nice to be back though, and a bit of change of weather from the Scottish rain to come to the Tasmanian rain. And I guess one positive outcome out of all of this is that I've been getting back into running and cooking, and I've managed to secure a PhD while I've been locked away, tapping away on my computer. Andreas, maybe if you jump in now.
Yes, I'm sorry, a phone is ringing here. I face almost the same problem as you. I was in an internship before the pandemic. When they told us that the university is not going to work anymore, I had to take this decision if I'm going to stay and wait till the pandemic will stop or to come back. Yes, so I decided to come back to my home, a difficult procedure when you want to take a plane during pandemic. But you know, all of the works I was doing actually, except my studies, I mean, on the One Health topic with the organizations I work with, everything was online because it was um, most of them was pre-organized online, independently of the pandemic. So it worked for me. We didn't had I didn't face many problems. I didn't had to cancel many of the projects that we were to run, like this one, for example. Uh, what I found very nice, like a positive outcome of this experience, was that during pandemic, people find a lot of free time to learn new things on One Health, and many people was interesting to participate even more on these things that we were planning. Even the creators of the projects were much more motivated, and because maybe the free time did that, and they were ready to work hard and create new things. They were very productive, all students around the organization. So it was harder for me because many people were coming and asking help for themselves to work. But it was very interesting, and I was very happy to help because something new was created. That's all.
Excellent, thank you. And maybe Navneeta, if we hear your thoughts.
Yes, sure. Thank you. So my story before the pandemic was that I was pretty excited in terms of this association because I was handed this association in early March, and I was really excited in terms of the activities that we are going to do, our new goals and objectives for the year. And I was really looking forward to a lot of things. But unfortunately, because of this pandemic, all this came to a halt, because one thing that I wanted to do this year is what I wanted to have a lot of collaboration. I wanted to have networking with other regional countries as well as the Oceania region, Australia and New Zealand. And we actually wanted students, medical students from the region and from the Pacific region in particular, to be a part of PMSA. And we wanted to have more relationships and networks and connections. But unfortunately, all that had to be put to a halt. And we could not actually go out. We could not do field activities. We had to be more of virtual based. But then the positive outcome from this was that we have actually made ourselves stronger. We've actually taken this challenge in a positive way, because challenges are part of life. Like everywhere, anywhere you go, we will have some sort of a challenge, and we just have to work around it. You have to work through it, and I'm sure if you have the good team, if you have good leaders together with you, and you will definitely make it through.
Yes, exactly. It's great to hear that positive energy, Leo. Krishna, maybe if we hear from you next.
Thank you.
So before this pandemic, last year after graduating, I joined for my postgraduate master's degree in veterinary surgery and radiology with a minor in veterinary medicine and public health in December 2019. Since I have graduated and I've been working in a small animal clinic as a veterinary surgeon, I have a very bit of a hectic schedule able to prepare for my study, and I wasn't able to give so much time to. After the starting of the pandemic, we provided the service for a few weeks, and then since our government has not listed the veterinary profession as the essential, so there was not much of a case, and I just came home, and after that the lockdown began to gradually ease, and people really began to move from one place to another, but I've been stuck here since the public vehicles are not allowed, and I basically walk in the capital of my country, that is Kathmandu, and I study in another district, that is Chittagong, around 70-80 kilometers from my hometown, and my workplace is around 300-400 kilometers from my hometown, and I'm really stuck in my hometown. And this has been a great opportunity for me, as I am able to explore different fields in One Health. I am able to attend various webinars, conferences, and meetings. Similarly, I have also been able to attend the meetings conducted by the government officials, public health professionals from my own country, and listening what they are doing, what they are doing for the to protect the country, to protect the people from the pandemic, and how the health system has been failing to do so. And in some instances, I'm able to provide some suggestions to various groups. I've been and I'm utilizing this lockdown and some sort of vacation like by exploring the One Health groups around this continent. I am establishing connection with them. I am inviting them to join ISOHA. I am spreading our informations to different organizations. I am helping them to build the organization and groups. And yeah, I've been able to study. I've been able to continue my study and so on. And basically, I've been working from my home through the internet. And yeah, it has been some sort of good and bad like that. Thank you.
Good to hear. I mean, there's always going to be those balances between the positives and negatives with this sort of thing. Bailey, did you have anything you wanted to add?
Sure. So I was on spring break when the pandemic got really bad, and my school decided that we would not be returning in person. So we finished the last 6 weeks or so of our semester online, which was fine. I got a little stir crazy just being in the house all day, but I stayed at school, which is only about 3 hours away from home for me, and finished the semester, and I did one clinical rotation of my 3rd year, and that lasted 4 weeks, and it was partially online and partially in person. So we were able to do some social distancing at school, wearing masks and all of that, and still get to go in person. So I was grateful for that hands-on experience. And then I had an 8-week break, which I'm currently on. So I think the biggest disruption for me was just not being able to go participate in a internship that I was going to be in. I was going to go to Washington, D.C. for 4 weeks and work with the American Veterinary Medical Association's Governmental Relations Division. And they do a lot of advocacy for the veterinary profession and public health. And then, of course, that includes One Health. So I was planning on getting to lobby for the One Health Act on Capitol Hill in Washington, D.C. So I was really excited about that. And then that, of course, didn't happen because of COVID. But, you know, kind of like the others have said, I feel like because of the pandemic, I've had a little more time to devote to ISOHA, and I've been able to, you know, contact my congressman and read more about the One Health Act. You know, I haven't been able to talk about it in person in Washington, D.C., but I've been able to, you know, still kind of engage in that just through email. So, yeah, overall, it's been okay for me. So grateful for that.
Well, it sounds like a good opportunity, and I'm sure you'll get to go to Washington eventually and see it fulfilled. Alrighty, so next up, we effectively had a break scheduled. I don't know, Andreas, do you feel like we need a break, or we can just sort of keep pushing through the rest?
Yes, we can leave the break. Like, let's go to the next one.
Yeah, that was sort of factored in if we were going to be taking an hour to get to this point, but we've skimmed right through. So next up, we're going to be talking about the partnerships that we as ISOHA are trying to foster, both more at the executive level from where we are, but how we can also have these stronger ties with these different student groups and student-led initiatives within each region. So in terms of our major collaborations, the One Health Commission on the bottom left is one of our principal partners. We pretty much work arm in arm with them. They're the more sort of professional branch, whereas we are focused more on specifically on student activities and trying to link students together. We're also a member of VaxVox, which is essentially a platform promoting vaccination and the effective use of vaccines. We have some light ties with the Southeast Asia One Health University Network. However, we still need to hammer out some details with them. And we've also recently had the opportunity to collaborate with the Lancet One Health Commission, or the One Health Lancet Commission. I'm not sure which terminology they're using. Which one of our current Secretary General, Walequa Abel-Wilson, actually attended just yesterday. So we're trying to build a stronger collaboration with them. Andreas, maybe if you had anything to add on that.
Not actually. I don't want to add something on that. In general, on this session, I would like mainly to hear from Navnita. I'm not sure for the pronunciation of the name. For people that will saw the webinar on YouTube later, what your organizations could provide as a potential partnership there, and how other organizations can cooperate with you.
I'll just unmute you now, Navnita.
Okay. So thank you. Yes, indeed, that is a very important question. And even I've been wondering how we can expand our boundaries and how we can reach out to other associations and our other organizations around the globe. So what PMSA actually represents the voice and interest of medical students from throughout the Pacific region on both on a local and international scale. So we are a peak representative body for student doctors and student medical professionals throughout the Pacific Islands. And we exist with the central intention of promoting international collaboration on medical research, health promotion, and clinical medicine between the next generation of health professionals. So for us, I would say I am open to ideas, I'm open to opportunities, and I'm open to exploring many other things. So I'm actually open to a lot of opportunities. So whatever comes my way, I can always liaise, we can always have a discussion, we can work things out, because I would actually love to work with other associations, and not just in medical, but in veterinary sciences as well. So even if you have a medical research that you are doing, a journal article, because we have our publications and editorials team. So if you are having a research, or if you are doing anything on your journals and health promotion, anything you want to share, you are always welcome to contact me, and we can surely work out something. That's all from my end. If you have any questions.
No, thank you very much. I hope that some people will find your proposal interesting, and you will start even more things there. And I hope that more people have the same spirit around your continent, and you can all together find some more potential partnerships place.
Yes, thank you so much. We actually have a website, so you can always have a look through. We have our initiatives, our events, and everything on the website.
That's great. We might actually chuck that into the slides after this, so people can access it afterwards.
Okay.
That'd be great. Yeah, we'd love to see that sort of collaboration. Thank you, Navneeta.
Okay.
Krishna, whilst you're more sort of in the Asia region, it'd still be interesting to see maybe your connections that you're having and partnerships that you're having within your region, I guess, specifically as a sort of how we in the Oceania region can collaborate and expand our boundaries. I'll just unmute you now.
Yeah, basically talking of collaboration, last year after being appointed at the representative for Asia region, I just contacted the director of Vietnam One Health University Network. I was in contact with her. She also provided some insight how to collaborate with the students from the Southeast Asia One Health University Network. Basically comprises of the university network of various countries. One of them is the Vietnam One Health University Network, and I was in contact with her about how to collaborate regarding the One Health issues. And I was in a certain idea of the exchange program between the students of the universities from different countries, so that they can exchange how their work are going on in regard to the One Health. And I was going to forward that proposal, but due to certain circumstances we were not able to accumulate the logistics and so on from our part, so we just failed, and it's still going on. We can still pursue that thing regarding the exchange after we have a strong foundation. But basically in this time of view, the pandemic has shown us different platforms for collaboration, and even though we may not be able to be physically close for the collaboration, we can virtually collaborate in different aspects, such as even we can take the research conference seminar with different organizations and groups across different continents and regions. That was my saying about the collaboration.
Yes, exactly. That all sounds top notch. I'll just unmute you now. Sorry, mute you. Sorry. Yeah. So effectively, it all comes down to principally how we all collaborate at this smaller scale as well, and how we can all sort of benefit, considering that most of these initiatives with student groups as well are generally unfunded, and so how we can sort of bring our resources together in order to make effective change. And well, that's the backbone of One Health in an essence, as well as ISOHA. This next section, where we talk about the future, we did have a section where we were going to talk about income and the different ways that we can be sourcing these things. But I've kind of rolled that into the future section, because, well, ISOHA currently, as it stands, doesn't really have a strict funding system. There was an initial grant to get the whole thing up and running, and since then there hasn't really been much funding. So that's really my job as the VP of Finance to lift up the game, and hopefully we'll be working out some methods of not only acquiring funding, but being able to redistribute that in the form of scholarships and grants to the students and the extended student network. So in terms of the future of ISOHA, we have a few set priorities. So we really want to expand our regional outreach and the opportunities. So whilst the executive committee is pretty tight-knit and we generally communicate quite well with our continental representatives, we really want the regional outreach and the individual, like institutional outreach, to be a lot more in depth, so that effectively continental reps or even sub-regional representatives will be able to sort of coordinate efforts within individual areas, and having that oversight will allow us even more collaboration, both between adjacent regions and between for people wanting to work with distinct regions. As I said just before, we want to be providing scholarships, grant funding, these sorts of things, being able to fund projects potentially ourselves, so allowing us to sort of bring these student groups together to work on projects that they're passionate about. On top of that as well, we are in talks to sort of develop a starter kit for ISOHA groups, because whilst ISOHA is we want to be the glue that is between these student groups, the student groups themselves are either run through the institution or through just the students themselves, and they are individual. They're not ISOHA chapters, so to speak. But we want to be able to provide things to these student groups so that they can get up and start it very quickly. So we'll be developing that in the next coming months. We're also talking about establishing international and inter-regional student projects. Like I said, that doesn't necessitate funding, but it will certainly help as we push forward. We're thinking about assembling new subcommittees, seeing as we have just essentially reshuffled our executive committee, branching out and understanding where our workload needs to be distributed, and how we're probably going to need a bit more work behind that, distributed between subcommittees and such, not just all on the backs of, say, one committee member or anything. We're also planning on launching the ISOHA journal. That is still in the works, and perhaps Andreas, in just a sec, you can probably take over and elaborate on that. And we also want to engage with regional stakeholders, as I said on the previous slides. Like, we want to be working not just with other international groups about One Health, but talking with literal people on the ground who can fund these projects or provide the other resources for these projects as well. Andreas, I don't know if you had anything you wanted to add on that.
Yes, just for the journal, as you said, it's something new coming. It's a long time that we try to create it. It's the first time that we make something like this. It's an educational journal, including educational articles. So when something is new, it needs time. So it's almost finalized. Is the designing part left? But every time you are going to the next step, something new is coming, and you have to solve it. So we hope that during this month coming, we will release it. It's including several articles on different One Health topics. It will be very interesting, and I'm sure that the next year it will be even better, as Bailey take of that. Just on I don't remember which point. It was about the regional representatives, as you said. For me, this is the most important thing now, as we are talking about who is who in a who's who webinar, is to find, especially for Oceania, good representatives. I mean, to have nice applications and to have motivated people that will come and find some more One Health clubs that exist somewhere there and we don't know, or they work on One Health but they don't know that this is One Health. So we have to bring them all together and make them know about each other and about ISOHA. So one of my personal goals for this year, as for the future of ISOHA, is to find these clubs that are out and come in contact personally with them to see how we can help each other. I mean, how they can help us in an international level and how we can help them locally there. Yes, Patrick. I don't know if you're trying to talk. We don't hear.
Sorry, guys, I just went on a complete riff and completely forgot I was still on mute. It's my bad. We essentially what I was just saying is, yeah, that's a great point, and we've just been sort of making baby steps with the committee so far, and we really want to be with this new reshuffling. We really want to be taking it to a point where we as a committee are thriving, and that and the communities are thriving also. And I guess what underlies that is communication at the end of the day, not just with between ISOHA members, but also just between the student groups themselves. And if we can just be intermediaries between student groups, between regions, between all of these things, that's what we want to be, establishing that communication and then letting you guys go and thrive yourselves. Anyway. So jumping to the next point. Yeah, so this was really, you can see that there's not that many points in the entire oceanic region. We have a few in Australia, a couple over in Papua, but we really want to be including all of the diversity of the region there. And I mean, we don't even have that many clubs from New Zealand participating, and there's quite a few groups there that I've been trying to reach out to. So we really want to just be engaging with everyone across the board. So make sure that your group's on our master list. You can add it through that URL there, and hopefully we will see that just lit up with markers by the end of this. So I guess just to kind of wrap up, I'd just like to say, well, first of all, thank you for joining us. You're the community that helps us keep going, and without you, we would just be talking into the void. So you can reach us at the Secretary General's email there. We also have our Facebook page, Central. There's also a Facebook group for sharing articles and ideas. And there will be regional pages coming soon as well. We also have a Twitter, as you can see there, our LinkedIn page, and our YouTube, where all of these videos will be posted. You should also have a link to these slides. I'll make sure it's in the YouTube description as well, so that you can access all of these links just as you like. And I guess that kind of brings us pretty much to a close, but just a final acknowledgement to the One Health Commission, particularly because they provide the go-to webinar platform for us. Otherwise, we'd be stuck using Zoom, which is good, but it's not that good. And I guess also I'd like to say thank you to all of the people here today and everyone who'll be watching at home in the future as well. Andreas, maybe if you had some final words.
Just thank you everybody for coming on this meeting. I wish all the best to everybody separately, and to your One Health clubs, and to the continent of Oceania in general. We will take into consideration every word said in this meeting, and probably you will receive a follow-up mail with some addresses suggested in the minute. And I hope to see you all at the next campaigns and projects that we will run the upcoming days. Thank you very much.
Thank you, Andreas. And I'll just unmute you guys and you can say a little goodbye if you like.
So I want to say something in behalf of One Health. So there are a lot of students who want to know about One Health, who want to pursue their career in One Health. It's like they are not getting the resources or the information regarding it. So it's so in the age of email and internet, in the age of web, so we can reach them through various platforms such as social media and emails. So there are a lot of people who just want to engage in One Health, but there has not been so much information about the various colleges or universities which provide them the opportunities. And also crucial for us, the student groups, to regularly conduct such meetings and seminars, so we can deliver the One Health message to the students who are in undergraduate or postgraduate level and who want to pursue their career in One Health, and also want to work as a leader in their community to uplift the One Health programs in their community or their country. Basically, one should act from their local level, from their villages, and from their societies if they want to flourish the culture of One Health throughout the world. So there has been a lot of people and a lot of platforms that have been giving us opportunities regarding the One Health. So we are not able to reach them. We can reach them by many platforms. So it is crucial for us to conduct such programs regularly. Yeah, thank you.
Seconded. And maybe Navneeta, if you had any parting words.
Yes, thank you. Yes, yes. Thank you, everyone. I believe this is a start for us. This is not an end. This is a start for us. And I agree with Krishna. We need to be in touch after this. We need to have more platforms for our members, for other associations, other organizations to be in touch. And we need to know more about each other. And I believe this is a really good platform whereby we can showcase our individual clubs, our individual groups, so that we are aware of what all is going around and who are the people who are there out in the region who can be potential leaders and potential contributors. So I believe this is a start for us, and we definitely need to keep up with this and do more as far as communication is concerned and reaching out is concerned. Thank you.
Exactly. Just one stepping stone on the way to a thriving oceanic community. Alrighty. Well, that's Bailey, if you had anything you wanted to add.
Yes.
Yeah. Thanks to everyone who came. And in the follow-up email, you will be able to see a whole page, a link to a page that's full of resources that ISOHA has. So one of the things we've kind of noticed doing these webinars is that we have some of the platforms that people are asking for, but there's just not much awareness that they exist. So we just want to grow awareness of like our spreadsheet that student groups can use to contact each other, and our email list and all of that. So if everyone can just help us spread the word that those things exist, that would be great. But yeah, thanks to everyone who came.
Cool. Yeah. And so without any further ado, I guess we can close the session. So thank you all for coming, and I look forward to all the future webinars that we have. Everyone have a great night.